Hi, and welcome to Lecture 7A. We're going to be focusing on key examination questions for the psychological and biological methods of stress management today. So in Lecture 7, we looked at the key psychological method, which is SIT, and there's a mnemonic to help you remember the stages. So it's child support agency. Remember, if you didn't see this one, go back to Lecture 7 to go and take a look at it. We also looked at an additional psychological method, which is hardiness training. We looked at the first biological method, which is drug therapies. So there's only one, which is drug therapies, but we have two drugs. So the first one are BZs. So to help you remember BZs, it's bust the zip girl. So that is BZs, and what the key chemical is GABA, which has a natural calming effect on our body, and that obviously helps us feel a bit better. Yeah, to help us alleviate the symptoms of stress. Okay, so we looked at a diagram last lecture as well, and the second drug was beta blockers, which basically acts on the key receptors on the cells stimulated during arousal. So receptors on things, for example, the heart. So remember when the sympathomedullary pathway gets put into gear, into action, it releases adrenaline and noradrenaline, and obviously our heart starts beating faster. We have higher blood pressure. So what BBs do, they reverse the effects of this. So they bind to the receptors on all the organs that are affected during the response, and they kind of reverse it. So the heart, for example, will start beating less and slower. Then we have lowered blood pressure, and that person inadvertently feels a lot more calmer. Okay, so a nice way to remember this is BB as in Big Brother, beta blockers, and A is adrenaline award. So basically, beta blockers work on adrenaline and help reverse the effects of adrenaline. Okay, so we're going to be focused on key examination questions. Again, Kerry is a talented badminton player. So Kerry is using Kerry, you can say it's an application question, so therefore you need to apply your knowledge to Kerry's situation. Okay, she's just been promoted to the first division. However, she finds these top league games very stressful because she thinks that she is not as good as other players. Now, the key thing here is if I was doing an examination, I would highlight she thinks. Thinking is a psychological issue because we can think positively and we can think negatively. Yeah, so I'll be like, she thinks, I'll be like, oh, issue here, cognitive, psychological, that she's not good as other players. And she believes that she's going to lose every point. She believes she's going to lose every point. That whole belief system is all about our distortions, our cognitive distortions, and stuff like that, the way our psyche works. Now her game is beginning to suffer, so it's now affecting her behavior. Explain how stress inoculation therapy, remember, SIT is a type of cognitive behavioral therapy. So she has issues with her thinking, therefore that's affecting her behavior. Yeah, so they've got here SIT could be used to help Kerry. In your answers, refer to details from the passage above. Again, that's the whole applying the scenario thing. So it's only worth 4 marks. You make sure you have a good 4 bits of information. So there you can talk about the 3 different stages. A child support agency. You've got the conceptualization phase. So Kerry and the therapist could sit down and discuss all the way she perceives certain types of stresses. For example, why she thinks that she's not as good as the other players, and start looking at it from different type of angles. The next stage would be the skills acquisition. So she'll be practicing those skills, for example, thinking differently. So not looking at players all the time as being better than her. And then you've got the agency, the A, which is application. So she's now going to apply it. So they're going to do some kind of like imaginary scenarios in the clinic with the particular therapist. So that should be enough once you apply it to get you your full 4 marks. Next question. Long-term stress is often accompanied by psychological and physical changes. Okay. Drug therapy, so here they're focusing on drug therapy, the biological method, is sometimes used to reduce these effects of stress. Outline drug therapy as a method of stress management. So obviously, we know we have 2 different drugs. We have 2 different anti-anxiety drugs. We've got BZs and we've got beta blockers. So you briefly just say what drug therapies do basically. So BZs, they increase the amount, they boost up the amount of GABA in our system, making us feel a lot calmer. And then you've got the BBs, which will reverse the effects of adrenaline, for example, help our heart to beat slower and lower blood pressure to help us feel calmer as well. So remember, you don't have to go into too much detail because it's a 4 marker, but you still need to kind of like name the key drugs and briefly about what they actually do in the body. Next question, to outline stress inoculation therapy as a method of stress management. Simple as use the CSA, conceptualization, skills acquisition, and application for 4 marks. Bang, bang, bang. No problem, no problem, no stress on that one. Very simple question. This 12-mark question, I've actually written it for you, so please take a look at lecture 7B to take a look how I've written this particular 12-mark essay. Yeah. And name one psychological method of stress management. So you can either use one, so it's 1 mark, just use one word for this question. So you can either use stress inoculation training or you can use hardiness training. It's up to you. Yeah, you've got a choice there. Just put one there. Okay, this question explains strengths of this psychological method of stress management. So whichever one you use here, so say you use stress inoculation training, you can talk about, again, it's for 5 marks. Yes, so just write all the, I didn't do all the lines there because I couldn't be asked, but all the strengths, for example, it cures both the symptoms and the cause. What SIT, so SIT does that. It's evidence has shown that it's worked better in terms of treating phobias than systematic desensitization. Yeah, all those kind of stuff you can put there. This question, Karen has been feeling extremely stressed for several months. So another application question. She has recently been promoted at work and is worried that she is not able to do the job properly in spite of praise from her managers. So her worry here, she's not able to do the job properly, is her way of thinking. She's thinking it. So she obviously has issues with her thoughts. She also finds it very difficult to say no, again, a problem with behavior there, when colleagues ask for assistance. Her health is suffering and she decides to try cognitive behavior therapy to help manage her stress. Explain what is involved in cognitive behavior therapy and how it could be used to help Karen. So what they've done here, they've used the umbrella term as CBT, which a lot of people are like, oh my God, I didn't learn cognitive behavior therapy. All that means is you now talk about a type of cognitive behavior therapy, which is SIT, and do exactly the same thing, the CSA. So you do conceptualization, apply it to Karen, skills acquisition, apply it to Karen, and application, apply it to Karen. Yeah, very simple. So you briefly talk about what cognitive behavior therapy is. So changing the way, changing our negative thoughts into more positive thoughts, which do therefore change our behavior. Okay, so that is the end of examination questions. Do take a look back, try these examination questions for yourself because it'll be really worth while, especially if you have examinations looming very, very soon. Please check back on lecture 7B, which I'm going to go through this 12-mark question right here. So there are several methods used to manage the negative effects of stress. These methods can be biological or psychological. Discuss 2 or more methods of stress management. And you're going to see how I've managed to do this whole little last section without thinking about a research study. Okay, guys, see you next lecture. Bye.